Hi, Dr. Matthew Gianforte here at LifeWorks Integrative Health. And if you've been following us on our series on how to avoid a knee replacement and prevent arthritis and degeneration from happening in the knee, then what I want to do on this video is I actually want to look at some different x-rays. I want to show you phase 1, 2, 3, and 4 degeneration. I want to show you what a failed knee replacement looks like. I want to show you the pre and post of some regenerative treatments, and I want to show you some different scenarios that people were told before coming in to seeing us, and then what we actually found. So I'm going to turn the lights off, and I'm going to get you up close and personal with these x-rays so you can kind of get a better idea when you're looking at your own x-rays, maybe at the hospital or a doctor's office, so you have a better understanding of what actually to look for. Okay, so here I've got us looking at some x-rays of some knees. Now, when we start to look at a normal knee, we should have an equal space between these bones. It should be bilaterally equal on both sides. And you can see that it looks fairly bilaterally equal on both sides. Now, this is actually, it's very close to normal x-ray, but this gentleman actually came in with a lot of knee pain. Had been going on for many years. So there's a couple other things that we're gonna look at and evaluate on this knee x-ray. One is we've got some rotation that's happening in the knee joint itself, which is gonna create inflammation and wear and tear on the articular cartilage on the end plates of those bones. If you watched our other videos, you'll know what I'm referring to when I talk about rotation happening in the tibia and then rotation happening in the fibula, and how they counter rotate to put tension on that joint and increase the wear and tear. Now, this person is probably in a very, very, very early stage 1, because if you look on the inside, the medial side of the knee, is just slightly, very slightly less than the outside of the knee, which tells us there's a little bit of degeneration that's going on there. Now, what would this person need in order to get this stabilized and maybe even corrected? Well, this person, they could do stem cells that would repair any damage that's in there. But more importantly for this person is we need to correct the biomechanics of that joint so that it's not increasing the wear and tear, and they're gonna see really fantastic changes. We would do some hyaluronic acid to help to lubricate that joint, and they're really probably gonna recover really, really nicely. So let's go to the next x-ray I've got here. This is actually a patient that came in to see us. They're in phase 2 degeneration, and you can look on the medial side of the knee. They're in phase 2 degeneration. And this person came in to us with a previous recommendation by an orthopedic to have their knees replaced. And when we put up the x-ray, I truly expected to see something that was much worse than what we actually saw. These knees should not be replaced. There's a space between those bones. Things are looking very nice. You want to go conservative on this first and start to rehabilitate and correct the alignment. Put hyaluronic acid, the lubricant, in there, and then more importantly, in this scenario, we'd want to add a regenerative therapy such as stem cells into the joint to help to repair any damaged tissue and cartilage that's already happened. So now let's go to phase 3 degeneration. And you know, some of you guys might recognize some of these knees as some of your own, or x-rays that you've seen that have been very similar to yours, okay? So now we take a look at the medial aspect of that knee. That's almost a phase 4 degeneration right there. This certainly would be closer to having a knee replacement. This is a phase 3. And so there's one more phase of degeneration, and the phases are based upon how much space is between that bone and the amount of arthritis that is showing up on the femur and the tibia. For this person, we did the same thing. We were able to inject stem cells. We did hyaluronic acid to lubricate, and then we stopped the degenerative process by correcting the alignment, they saw fantastic changes. They got to the root cause of the problem. They were able to avoid more cortisone and a knee replacement. Now, this gentleman, actually this next one, okay, let me show you this one. This one right here. So this is actually like a phase 1 degeneration. There's just a little bit of unevenness in the inside of that joint. Now, this is a patient that came in who has a friend that is an orthopedic surgeon, and this friend told him that he was going to need to have a knee replacement in 5 years. And that friend was doing this gentleman a disservice because he has fantastic joint spaces to continue to work with, continue to preserve that knee and prevent any knee surgery or replacement from having to happen if they just take the right steps to move in the right direction. And so I'm not sure where this patient is in their care. I do know they did not go with a knee replacement or anything along those lines. I believe we're still working with this gentleman here. So let's go to phase 4 degeneration. Now, phase 4 degeneration, these knees absolutely could use a knee replacement. Now, these knees are from somebody who absolutely wanted to avoid a knee replacement. And so she pushed it right to the end as long as she possibly could to get a knee replacement. Now we can see in here that there's rotation externally with the tibia, internally with the femur. There's a lot of arthritis on the actual articular surface itself. You can see it's more white along those areas, meaning there's calcification deposits. We have calcification deposits on the outsides of the joint, so it's very arthritic. This is where you don't want to get to. This is where you want to be more proactive rather than reactive. And she'd been working very hard for a number of years with the hyaluronic acid, the lubricant, the rehab, but inevitably it got to a point where she needed to have a knee replacement because it just got too bad. Now the next image I want to show you, this is somebody who actually did receive a knee replacement, but this is a failed knee replacement. So most knee replacements are just going to have the top and the bottom cap on those bones. But this particular person has had 5 different knee surgeries and had to have it redone 5 times. This is why you see this bone literally just kind of crumbling away underneath, and they have these huge rods going up and down the femur and the tibia to support that knee. Now, her exact words were this. She says, "I wish I would have never had the knee replacement because I'm in a lot more pain now than I ever was in the beginning." And so unfortunately we hear that very commonly, but there is a time for knee replacements and there's a time when we don't need knee replacements. And it's always very important that we try to take the most conservative approach first by correcting the alignment, balancing the muscles, getting a lubricant in there, and slowing down any degenerative process without cortisone and without surgery first. Now, of course, we don't know what her original x-rays actually looked like before she had surgery, so we can't comment on that. But what we do know is if we can avoid this at all costs, she certainly would be much healthier and being able to be more mobile than what she is now. Now, this next x-ray I want to show you, this is actually somebody who's in phase 4 degeneration. So you can see right on this lateral aspect of this knee, looks like it's pretty much bone on bone. The medial aspect is still fairly open yet. So she had gone into an orthopedic first, and the orthopedic recommended that she had a knee replacement surgery, and rightfully so. It's very degenerative right there. The problem was she didn't have any insurance, no Medicare. She was from another country, and she didn't have $55,000 in order to pay to have that knee replacement actually done. And so what she had to do is live with the pain. Then she came to us for a second opinion, and we did our evaluation on her, and we saw exactly what I showed you in those other videos. We saw tightness happening on the outside, forcing that knee in. We saw weaknesses on the medial side of the knees. We saw rotation happening in the tibia and the fibia. And then we saw this arthritis and degeneration happening. So with her, what we did was we put her through our regular rehabilitation care to correct those imbalances. Then she was doing the hyaluronic lubricant injections into the knees to help that. But then she also added stem cells into the knee to help regrow any tissue that was in there. So our treatment was about a fraction of what the actual knee surgery was going to cost her. So let's take a look at what it looks like 2 months later after we've done care with her and regenerative therapy. You can see increase in growth right there. The leg is now more balanced. Her pain went from a 10 out of 10 down to about a 2 or 3 out of 10. So she was more functional, she was happier, she was able to do the things that she loved to do, and she really got her life back in a lot of ways. And people ask me then, okay, well, how old was she really? Well, this gal was 72 years old. So you're never too old to start taking care of your joints and start moving in the right direction. So I hope this kind of gives you a better understanding of what x-rays should look like and how we assess them and determine what care you need to help correct the imbalances.